What's up, everybody? This is Dr. Zach Baker, and you are listening to the Strength in Knowledge podcast. And today I have on with me Dr. Josh Funk, who wants to talk about is Elon Musk wrong? With a recent article that came out regarding a neck injury that he had, where he pursued artificial disc replacement and made the recommendation that this might be the thing for those with chronic neck pain. So a lot to unpack in this article. Obviously, you can't paint this article with a broad brush, but I do think it warrants just deep diving a little bit into, why do we get neck surgery? What are the different parameters that might lead to it? And how is this individualized from one person to another? So, Josh, I know that you are familiar with this. So what are your thoughts when you read it?
Yeah, and for everybody who is not aware of this, I'm referencing a tweet from him, or an X now. I don't quite know what to call it, but on April 15th at 2:34 p.m., and it said, if you're experiencing severe neck and back pain, I recommend looking into a disc replacement. And then on a subsequent follow-up tweet, he said, it's a game changer, took my pain level from a 7 to 9 out of 10 to a 1 to 4. And I think the biggest thing here that I would say is, it's tough in situations like this for people to watch individuals with very, very big platforms give out very broad sweeping medical advice, especially in situations where largely there's going to be some level of confirmation bias for the individual. They did something themselves. It may or may not have worked because of the actual thing that went on. This individual is not attaching their statement with any kind of literature or research or sharing the contextual factors that went into their decision-making process, other things that they tried. And we're largely seeing a 20 to 30 word tweet online where a lot of people are going to take this person's statement into serious account. So I think that's always the challenge for us. I mean, we have conversations about big medical platforms. I mean, even more recently, you have the Huberman Lab coming out with a podcast on low back pain. And what we would suggest is making sure that you are having conversations with your audience, whoever your audience may be, on these various topics. They are real things that they're getting exposure to on a regular basis. And if you're trying to educate the consumer base that you are looking to serve, you need to be a part of the conversation. You may never have a platform of an Elon Musk or an Andrew Huberman, but you do have influence over people. But let's dive into just neck pain overall. Zach, I mean, what are some of the things that ideally people would have considered prior to even, potentially doing something like disc replacement, or at least on my brief, search online? I mean, there's not a whole lot of research to substantiate the claim that he made.
No, and I will say one thing, playing devil's advocate is, yes, he has a lot of influence. Yes, he made a statement, but it didn't just say, hey, this is the only option out there. It said, I recommend you going to familiarize yourself with it, look into it. And I think that's where you need to read between the lines and figure out, well, hopefully, what are some things that he has already trialed or already experimented and sought out that he was unsuccessful with that led to the decision of getting this artificial disc replacement? And things that I look at with that is, one, are we doing something such as conservative as physical therapy or chiropractic treatment or something along those lines? Have we met with somebody and actually figured out what's contributing to this? Was there a specific mechanism of injury? Was it a high trauma injury or a fall or something that's a little bit more definitive, a little bit more kind of high stakes in regards to the sense of urgency that we need to act? And then also, what's the level of pain that we're dealing with? Is this like 2 out of 10? It's more of a nuisance and an annoyance. I don't want to speak for everybody, but I don't know if that warrants drastic surgical intervention compared to, are we having 8, 9, 10 out of 10 pain that's preventing us from living a quality of life, performing our occupational demands, and just being able to get through our day-to-day? Those are two drastically different situations that may warrant different levels of triaging with that. I think depending on the state that you're in, who you're seeking out first is going to be very important as well. You may live in a state that doesn't have direct access, And you need to go see your primary care physician before you can even go see a specialist, whether that's a neurologist, whether it's an orthopedic, whether it is somebody in the PT, chiropractic space. But I think making sure that, especially when I hear the word chronic, and if there's no mechanism of injury, and I believe he did have a definitive mechanism, but if there's not, we want to make sure that what we're dealing with neck pain is actually a disc-related issue. And there's a lot of different things that can present pain in the neck, traveling down the arm, that could potentially be non-disc or neurogenic in nature, that in those instances, that surgery would not be beneficial. And that's where your primary care physician comes in, doing a general screen, making sure there's nothing from an internal medicine or more systemic standpoint that could be contributing to that. After that, go see a specialist. Maybe you're seeing a neurologist, maybe you're seeing an orthopedic, and they're getting some degree of imaging to figure out, from a structural standpoint, what are we working with? And now, structure, function, symptoms, they do not always directly correlate with one another, meaning you can have things on an image that look pretty bad, and somebody may be unaware that they're even that way. And you can have other images that look relatively benign, and somebody could be severely debilitated or very limited from a functional standpoint. But I do think there is validity and usefulness to getting imaging done just to have an idea of what's the landscape that we're working with. And then ideally you go see somebody who does some sort of movement assessment with you, and they figure out, what does our range of motion look like? What does our strength look like? What does our movement quality and just kind of movement pattern look like in regards to how we're doing things, and how does that match up with our day-to-day demands, occupational demands? And when you pair that with the mechanism of injury and what the structural findings on an image look like, you can start to paint a little clearer picture in regards to what are the most influential factors in why somebody's feeling the way that they are. Is it because they have a disc issue or a nerve issue where there's impingement or narrowing of a space or potentially a tear or a rupture? Or are they just doing things from a daily standpoint that are putting that area in a more vulnerable or compromised position? And with education, awareness, and training, we can decrease those effects. So, I think I have worked with individuals who have gotten the artificial disc replacement done. It's not at the number and prevalence of a lot of other surgeries, mainly because it's a little bit more nuanced of a surgery. You can't just find any physician and surgeon that does the surgery. And fortunately, we're in the DMV area. So between Baltimore, D.C., we have a lot of highly trained, highly specialized surgeons in the area where it's not as unusual for us to come across these patients, because patients, they have the option of getting somebody to do the surgery who is trained in it, who has experience, and is very comfortable and competent with it.
I think in situations like this also, you have a self-proclaimed workaholic. He works all the time. We don't know what type of things he's doing throughout the course of his day. We do know that he's not a tremendous sleeper. He's not somebody who sleeps for high volumes of time. And if we at least look at the various photos of Elon, over time, I mean, his weight has fluctuated greatly. So he seems to potentially be an individual where, from a lifestyle factor standpoint, we also would want to consider certain things, knowing that these all contribute to an individual potentially having either more sensitivity or less sensitivity, especially in situations where we hear the word chronic. We want to make sure that we're looking at a variety of different factors, knowing especially that in that instance, we're probably not dealing with a situation that is anything other than a multifactorial approach. And what I'd recommend for all the clinicians out there who are listening to this is that you can't just dismiss Elon's tweet without also talking about the various layers that could have gone into the decision-making process, or the other things that we would have removed ideally from the table before making that decision. If you are trying to create a scenario in which you have educated consumers for what it is that people are trying to do from a decision-making standpoint as it relates to their health and wellness, you can't just dismiss something without providing additional information. So this is where it comes into play, where it's very, very important that you are taking upon yourself to provide resources for people, whether or not that's things through social media, things through PDF, things through a newsletter, through your company, maybe it's certain website pages. there is an ecosystem that you need to be able to provide people with regards to the information, not just the ecosystem of things that Elon has, hopefully gone through before getting to a disc replacement surgery. As it relates to disc replacement, and I know this is a stretch here, but we have more and more joint replacements now. We used to have hip and knee. Now we're seeing a lot more ankle, and we're seeing a lot more shoulder. This could potentially be something that we are dealing with more and more. And I can't help but sometimes think of situations where people had surgery, they rested for the first time as a result of having the surgery, and then they actually went through their true course of care. And as you mentioned earlier, we hope that he went to at least one conservative, dare I say, sports medicine-oriented professional, but rehab professional, could be chiro, could be PT. And if one didn't work, then hopefully he went to a second person as well. I don't know what access to medical professionals these individuals have. I think sometimes that we can agree that just because you're in the higher rungs as it relates to the people that you're interacting with doesn't necessarily make you the most qualified. You might be the most networked, but that's a separate conversation in itself. Zach, what recommendations would you have for clinicians out there who realize that this is an issue with regards to misinformation that they're encountering on a regular basis, or potential misinformation, as it relates to them using their platform to ideally educate their consumer on an improved level?
Yeah, I think the first thing you do is you need to be aware of what you are educated on and what you are less educated on. And I've been practicing for over a decade now. I've seen a variety of things in the orthopedic and sports space, but I'd be lying if I said there weren't occasional patients that come in with a very kind of nuanced injury or presentation or a different surgical approach that I just had not seen yet. And what I typically do there is I familiarize myself as much as I can with whatever the literature is. I reach out to the surgeon if they're available to talk to, or at least others within that space, and try to learn more about it from the rehab side of things, from the medical side of things, so that I feel comfortable talking intelligently on it as well. And then I think when you try to educate the masses, or you're speaking to somebody other than just a N=1 sample size of the patient in front of you, you need to remember that what you're saying is not a one-size-fits-all approach. And this is, in the article that followed up this tweet, I had less of an issue of him saying, hey, you should go familiarize yourself with this surgery. He later then goes on to say, I would recommend getting a hinged disc replacement as opposed to a multi-directional and one that has the ability to move and rotate and move in all directions. And he goes into stability and all these other biomechanical factors, which he's brilliant. He's way smarter than I am. He's not a neurosurgeon. He's not an orthopedic surgeon. And this is the same conversation I have with patients when they come in for an ACL injury and they say, hey, what graft should I get? Should I get a cadaver? Should I get a hamstring? Should I get a patellar tendon? And I express to them the outcomes that I see as a clinician on the rehab side of things, but I've never harvested an ACL graft or performed an ACL surgery. That's not my scope of practice. That's not my wheelhouse. So I tell them, hey, these are the common graft sites that they use for an ACL. These are the potential complications or just, shortcomings or things that you'll see in the research. Or if you go online and Google search this, which they're going to, these are the things that some people mention with the patellar tendon graft. These are the things some people mention with the cadaver. This is what the research says. As a clinician, I also know the limitations of some of the research. A lot of times they compare grafts or different surgical techniques, and I'm using air quotes, physical therapy was performed for all these different patients. We don't know what that looks like. So I tell them you're going to have some people that are going to have successful surgeries in spite of the procedure that was done, and you're going to have some people that have complications or failures even though a tremendous surgical approach and technique was performed. But like you had alluded to earlier, surgery and the outcomes after surgery is multifactorial. A surgeon can do a picture-perfect procedure. If the patient doesn't show up for PT, and they're supposed to, it's probably not going to go well. If the patient shows up for PT, but their PT is not following the protocol or just not the most up-to-date with what they should be doing, it's probably going to be substandard outcomes. Or they can have a good surgery, they can be attentive and do good quality PT, but if they're not sleeping, if they're not taking care of themselves, if they're not eating well, if they're a smoker, if they have other comorbidities that are being left unaddressed, you're going to have all these different factors that can potentially lead to an unsuccessful outcome. And it has nothing to do with the surgical approach, the actual execution of the surgery, or the plan of care following it from a rehab standpoint. So I think my biggest recommendation, familiarize yourself and aware where you are with being on where you are with your own knowledge level. Try to speak accurately. Speak on the stuff that we definitively know, and don't try to draw your own conclusions. And don't be afraid to reach out to others for clarity on topics as well.
Yeah, I couldn't agree more. And the thing that I always recommend in situations like this, you can be upset at Elon for making the recommendation. You can be upset that he has the platform that he does, but he has earned the platform he does. We can do whatever we want with our platforms. We don't have to agree with what he's doing with his platform, but it puts more and more emphasis on the importance of us as physical therapists or rehab professionals to develop our own platforms and to really take ownership over that part of our brand, and getting more serious about personal branding, getting more serious about selling our value, educating the consumer. That needs to be more of what we take pride on moving forward, as we are continually realizing the importance of the personal brand. So for young professionals out there, make sure that you are doing what you can to develop your platform. And that's the only way at the end of the day you can combat what you would quote call misinformation.
Yeah, and I think I look at this as less of a position statement and more of a conversation starter. So that's the big thing I take from this. We're talking about disc replacements where I probably would not have been talking about it a week ago unless I had a patient dealing with one. So thank you for tuning in. You are listening to the Strength in Knowledge podcast. Dr. Josh Funk, thank you for coming on today. If you enjoyed this episode, please like, share, and subscribe, and stay tuned for the next episode.